It's going to cost about $2 billion to transform the aging portions of Juravinski Hospital in Hamilton. And one patient says it's much needed. Julie Sharp got an inside look today.
Well, my current experience here recently has been spending 3 nights in a hallway, which was basically deplorable and degrading.
Joe Harte has been a patient at the Juravinski Hospital for the last 2.5 weeks. He says it's been a rough experience at times.
You've got no privacy. You don't sleep at nighttime. You basically got no hygienist. You got to go to washroom on a bedpan in the hallway with nothing covering you up.
Harte says having his own room would help with privacy, which is one of the main goals of the hospital's plan to transform parts of the aging building.
So our E and F wings are 70 years old. M wing is over 100 years old, and the reality is that clinical medicine is a lot different now in 2024, 2025, and beyond than it was 100 years ago. They're really not meeting the needs of patients in terms of privacy, in terms of all the equipment that we use for patients.
Bigger hallways, elevators, heating, and ventilation are also a part of the rebuild.
There is been a little bit of a struggle because, as you guys have seen, there's been a lot of cramped spaces, even the washrooms, the hallways, there's always an obstacle in the way.
So this is the only shower room that's available for use for 39 patients on this unit. Staff say that sometimes it's being used as a storage room because of the lack of space. Now, with the new developments, each room is expected to have its own shower.
So this is an example of a new inpatient room. This is built in the last 5 years. Every room on this patient ward is a private room, which means every patient has their own room. That is helpful in terms of infection control to prevent the spread of disease, but they also have a private bathroom with a private shower.
The project is expected to come with a heavy price tag, likely the largest health infrastructure investment in Hamilton.
It's probably in excess of $2 billion total. And so when you take a look at the local share, it could be as high as $300 million that we need.
The work will add 100 more beds to the hospital. Construction is set to start in 2028. Julie Sharp, CHCH News, Hamilton.